2013, every state in the United States and every province in Canada have had bloodless, large animal mutilations as well as other countries. Here is a close-up of that particular serrated edge from the side in the 1990 Oregon steer serrated excision that an Oregon State University Veterinary Diagnostic Laboratory reported had been cut with high heat, image 5, consistent with a specimen collected via electrosurgical excision. It is not possible to tell whether this lesion was caused by a laser. It does appear consistent with a heat-induced injury, close quote. The issue of lasers came up early in the animal mutilation mystery because there was no blood. There had to have been some kind of cautery. But then I worked with John Altschuler, MD, pathologist and hematologist in Denver, Colorado. One of his first confirmations was cooked hemoglobin in a mutilated cow. Slide 6. Here is what normal cow collagen looks like under a microscope, image 7. And here is mutilated cow tissue in which the hemoglobin has been cooked by high heat at the excision site. Dr. Altschuler also showed me photomicrographs of the mutilator's excision in comparison with known laser surgery. Dr. Altschuler said, quote, "The animal mutilation excisions do not show any carbon, but Earth life is carbon-based and all tissue exposed to the heat of a laser should show carbon residue that looks like black pepper grains under a microscope," quote, unquote. We never found any carbon residue on mutilator excisions we studied, raising the question, what is the surgical instrument? Does it work by sound frequencies or some other technology unknown to Earth medical science? Photomicrograph number 1 has an arrow which points to the separation line. The abnormal tissue on the left shows a smudged pink change with nuclear fragmentation, indicating tissue destruction and death. These changes are referred to as coagulative necrosis. The band between cutting margin and normal tissue is quite thin, suggesting that the dissection was done with what appears to be a pinpoint accuracy and minimal dissipation of heat at the cut line, close quote. The heat is confined to a millimeter in these excisions. In this photomicrograph, the tissue is from below the hide surface and is called dermis. The upper portion clearly shows many spaces called vacuolar changes where the arrow is, which result from tissue cooking or exposure to high temperatures, probably above 300 degrees Fahrenheit. Image 12. In the lower left-hand corner of this photomicrograph is a distinct color change from a light normal pink to a dark pink. The darker collagen tissue is damaged from some injury source, but shows a striking lack of inflammatory change. This suggests that the procedure of injury was relatively fast. Taking all the microscopic findings into account, one would have to conclude that the surgical procedure performed on these animals took place quickly, probably in a minute or two, and utilized high temperature heat as a cutting source applied in a fine probe or cutting instrument, close quote. And we are talking about the excision of an ear, eye, jaw flesh, tongue, the sexual organs, and the rectum in less than 2 minutes.